All right, thank you so much for staying until the last session of the day. I know we are running extremely late, so I'm going to be extremely quick while delivering quick and messages. Yes, to the point. Thank you again for receiving me. I was here in March, very happy to be here and explaining and refreshing your memory of why a pet food company is sponsoring a masterclass in allergy for humans. So why? The reason why is after a decade of research, Nestle Purina Pet Care just launched a product, a cat food that is managing cat allergies in humans. So the quick agenda of today, we are going to talk about the impact of the human bond when you have a pet owner that is allergic to their own cat. We are going to talk about the main culprit, which is FeLG1, and as well I'm going to quickly go through a couple of studies. If you're interested to receive it from via email, I am willing to send it to you by PDF as well. So globally, how many humans are allergic to cats? 1 out of 5. The prevalence is increasing. This is the most common animal origin allergy in human. And it's also very common in children, as you can know. The impact are from both sides. As a pet food company, we are very keen on keeping this pet-human bond. And usually when you receive a patient, cat allergic, cat owner patient, they do not want to rehome their cat, or they do not want to isolate their cat. So your treatment plan is going to be a bit difficult because they don't want to get rid of their cat, and as a pet food company and welfare reason, we do not want them to ask them to get rid of them. So we created this pet food that I will explain you a bit later on, but we need to identify why are humans allergic to cats, and this is because of this allergen called FeLG1. Cat produces multiple allergens. They are producing 8, but 95% of humans are allergic to this one in particular, FeLG1. It is produced in the oral cavity, in the salivary gland, as well as the sebaceous glands of cats. Then once they groom themselves, the protein goes onto the hair, then gets released into the environment because, cat lose hair. The active life of this protein is 24 weeks, so it's extremely long to get rid of it. Even if you clean intensely, it can take a bit of time. All cats produce FeLG1 no matter what the age, breed, sex, size. So we are targeting all cat owners here, and there are no truly hypoallergenic cats. This is just a marketing slang. The science behind Live Clear, so as you can see, there is kits a bit everywhere in the room. So if you are dealing with cat owners, cat allergic patients, you can recommend this food to try for at least 3 weeks, but I will explain you what has been done from a scientific point of view. So because we don't know what FeLG1 does from a cat perspective, we didn't want to stop the production. We just wanted to neutralize the protein as its source, which is in the mouth. So we created a pet food that as soon as the cat chews, an antibody is released into the oral cavity of the cat, binds to this FeLG1 protein and neutralizes it, right? So multiple of studies has been done. As I said, I can send it to you by email if you're interested to. My card is at the booth over there. But today we're going to talk about the preclinical studies that has been done on cat, as well as the clinical study that has been done on human, just to confirm the proof of concept. So in here, we looked at the active salivary FeLG1. So we had, in this study, 20 cats. They were fed a controlled diet for a week, so a basic diet, then switched into 2 groups. One group was kept on this controlled diet. The other was switched to a test diet. The test diet is the one that you have on their kits. And then on daily basis, we collected salivary sample to monitor the FeLG1 levels. after 4 weeks, we drastically saw a reduction of 24% of FeLD1 that were active. After that has been established, we looked at here how much active FeLD1 are put into the hair once the cat groomed himself. This study is a bit longer. It was 12 weeks and 105 cats were enrolled in this study. So the first 2 weeks, we established a baseline feeding a control diet, then switched them to the test diet. And as you can see on the 3rd week here, we can see a drastic decrease of active FeLD1, and the result reads as 97% of those cats showed reduced active FeLD1 compared to their baseline. So most of the cats, we could see a reduced active FeLD1. At least 86% of cats showed at least 30% reduction, and half of those cats showed at least 50% reduction. So what do? We claim on our pack, and we can ensure that at least 47% in average, we can see a reduction of FeLD1 levels. The range varies between 33 to 71, depends on the cats, because some cats produce more FeLD1, some cats produce less FeLD1. So it depends from individuals to individuals. Okay, so the last proof of concept, we wanted to see if it was working on humans, because technically if we reduce active FeLD1, would we see a decrease of symptoms? So we had 9 patients, and we were priming them into a closed chamber, exposing them to FeLD1 to ensure that they were allergic to cats. And if they were allergic to cats, they were enrolled into the second session. Second session, which was a week later, they were exposed to blankets of cats that were eating a controlled diet. And on the 3rd session, they were switched and they were exposed to blankets that were fed the test diet. We asked those patients to monitor those symptoms for every 15 minutes based on this table. So we measured the total nasal symptom score, which is runny nose, sneezing, itchy nose. And then we also monitored total ocular symptom score. So we asked them to monitor that every 15 minutes, even if they were in the chamber with the blankets that were fed the diet or the blankets that the cats were used to eat the controlled diet. After this study, we saw a significant decrease in total nasal symptom score, nasal congestion, scratchy eyes, and itchy eyes. And I was here in March last time presenting to you, and I'm very happy to see some of you today again and receiving feedback from your patients that you can see actually an improvement in terms of symptoms. So this is the current pathways. The cats produce FeLD1. The environment is then, the FeLD1 is spread into the environment, and then the individual reacts to the exposure. As a healthcare practitioner, you usually, as I said, recommend avoidance, cleaning products, costly, immunotherapy as well, costly sometimes, not a lot of people can afford it, and medication. All of those have limitation at some point, and this is where our products act before it gets released into the environment. So this is the summary that we can decrease exposure to cat allergen while keeping the cat at home. And just talking about the product, this is the reference, very happy to share with you as well. The product, very quickly, it's a dry food. This has to be given lifetime to cats. And to see at least results, it's 3 weeks consumption. 3 weeks consumption is approximately 1 bag, and you can find it on Amazon, veterinary clinic, InstaShop, depending on your location. All right, that's it. I had to expedite, but thank you so much. Thank you.